Good morning. This is Mr. Divo. This morning I want us to answer a question concerning glaucoma. If you are new, subscribe to my YouTube, Mr. Divo class. So let's look at the question I want us to understand or to answer in brief. So Mrs. Kachimfia, a 35-year housewife, is admitted with a diagnosis of chronic simple glaucoma and iridectomy has been done. So part A, they are saying define iridectomy. Part A2, they are saying state 5 predisposing factors to glaucoma. Then B, they are saying with the aid of a well-labeled diagram of a cross-section of the eye, explain the intraocular fluid circulation. C, identify 5 nursing problems that Mrs. Kachimfia may experience and using a nursing care plan, outline how you are going to manage Mrs. Kachimfia. D, they are saying outline 5 complications of glaucoma. So let's define iridectomy. Iridectomy is simply surgical procedure done to relieve pressure by excising, which is cutting off part of the iris to re-establish the outflow of aqueous humor. So this procedure is all about opening up, re-establishing the outflow or the path for the outflow of aqueous humor. State 5 predisposing factors to glaucoma, that's A2. Now, predisposing factors, number 1, it's age. People who are over the age of 60, they are at risk of developing glaucoma. Then certain races like Japanese, Africans, and Americans, these are slightly more likely to get glaucoma than other races. Then from there, the other predisposing factor is medical condition. People who have high blood pressure, diabetes, they have an increase or they are at risk of developing glaucoma. Then physical injuries to the eye or severe trauma such as being hit in the eye can result in immediate increased eye pressure. So such damages causes inflammation, and we know what happens in inflammation. There is edema and a swelling. Okay, so injuries can also dislocate the lens, causing the drainage angle or increasing intraocular pressure. Then the other predisposing factor is other eye-related risk factors. Okay, such conditions like retinal detachment, eye tumors, or any other eye inflammations may also trigger glaucoma. Even certain features of the eye anatomy, for example, finer corneas or optic nerve sensitivities, indicate an increased risk for developing glaucoma. Then the other one is corticosteroid usage. Using corticosteroids, including cortisone, hydrocortisone, or prednisolone, for prolonged period of time appears to put some people at risk of having or getting secondary glaucoma. Then family history of glaucoma. Then with the aid of a well-labeled diagram of a cross-section of the eye, explain the secretion of intraocular fluid. So on this one, this is a diagram we expect to see. Of course, those are the features we expect to see. Of course, show us the basic structures, the lens, the anterior chambers, the cornea, the sclera, the retina, the optic nerve. So show us such basic structures of the eye. Then in brief there, you need to explain a bit on the secretion of intraocular fluids. So here we are going to say aqueous is formed by the ciliary or in the ciliary processes in the posterior chamber, and it flows through the pupil to the anterior chamber, and it exits the eye actually through the trabecular meshwork into the Scremsey canal, then draining into the venous system through the plexiform of the collector channels. So this is brief about VC, or this is how you can go about this question. Then from this one, you can move or you can identify 5 nursing problems that Mrs. Kachimfia may experience, and using a nursing care plan, outline how you are going to manage. So the problems which we can easily identify here are the following. Number one, of course, there will be pain, there will be high risk of injury, there will be ineffective therapeutic regime management, and also there will be anticipatory grieving or fear or anxiety. The other one is self-care deficit. So let's look at the nursing care plan. What should we consider? So in a nursing care plan, the problem number one we should consider is pain. So here pain, the nursing diagnosis under our nursing care plan will be that pain related to acute increase in intraocular pressure, inflammation caused by corrective procedures evidenced by crying or verbalization by the patient. So what will be your goal? Your goal here is simply to relieve pain within 6 hours. So what are your interventions and rationales? Number one, we are saying the patient will be assessed for the levels of pain initially to act as a baseline data in the management of pain. Then we will be assessed frequently for pain. From there, intraocular pressure will be monitored frequently as it is directly related to pain in glaucoma. This will also be done to determine the effectiveness of drugs being given. Then the prescribed miotics or beta-adrenergic blocking agents and carbonic anhydrase inhibitors to control intraocular pressure and thereby reducing pain. Now, analgesics will also be administered to relieve pain. Then evaluation will be that the patient will stop crying and verbalize the relief of pain. So take note of the interventions. We don't only give drugs, take note of other interventions which are necessary in stopping or alleviating pain in glaucoma. So the second problem we've discussed is high risk of injury. Now, high risk of injury, the nursing diagnosis will be high risk of injury related to progressive visual loss due to disease process. And the goal of this one will be injury-free throughout acute phase of glaucoma. This should be your goal, making sure that the patient will be injury-free, throughout acute phase of glaucoma. So what are the interventions and rationales? The patient will be nursed in clean, dry, and well-lit room to prevent him or her from bumping into items in the room. Then he or she will be advised to call for help whenever he or she wants to go out of bed so that he or she can be assisted to prevent he or her from falling and sustaining injuries. Then he or she will be given adequate information or IEC on which drug he or she can use to instill in his or her eyes to avoid his or her eyes from the unprescribed drugs. So the evaluation at the end of the day will be that the patient did not sustain any injury throughout the acute phase of glaucoma. Then, problem number 3. Here it will be ineffective therapeutic regime management. And what will be your nursing diagnosis? Your nursing diagnosis will be ineffective therapeutic regime management related to knowledge deficit about the disease process, treatment complications as evidenced by failure to follow treatment regime of prescribed drugs. Then what will be your goal? Your goal here will be that the patient will demonstrate knowledge in therapeutic regime management of his or her condition. Then interventions and rationales. What are you going to do and why? The patient will be educated on his or her condition so that he or she may be able to follow treatment regime as prescribed, thereby reduce on unnecessary relapse of attacks. Then he or she will be educated on the need for adherence to drug therapy to control intraocular pressure and reduce the risk of complications. This is so because the open-angle glaucoma is actually painless, and as such the patient may not appreciate the need for ongoing treatment. Then the other intervention and rationale will be that the family will be educated on the need to encourage and or to help the patient to follow the prescribed drug regime. Then here we also allow the patient to ask as many questions as possible and answer as honestly as possible. Then here we are also going to maintain a calm atmosphere to promote psychological rest or to allay some anxieties. Then what will be the evaluation at the end of it or after these interventions? We are saying what we expect is that the patient and the family will demonstrate knowledge in therapeutic regime management. Let's move to problem number 4. Now, on problem number 4 here, the problem is the anticipatory grieving or fear, or in short, you can simply say anxiety. Now, here, what will be a nursing diagnosis? The nursing diagnosis will be that anticipatory grieving or fear, which will be related to actual or potential loss of vision manifested by restlessness or lack of sleep. Then what will be your goal? Your goal here will be that the patient will have reduced anxiety and will be able to rest and sleep within 24 hours. Then what will be your interventions after this goal or this aim or this objective? Number 1, you are going to give psychological care to the patient to allay anxiety and assure the patient that everything is being done to better the condition of the eye. Then from there, you are going to explain all the procedures being done on her and why they are being done to gain cooperation and allay anxiety. Then a good clear explanation and every stage of management will be given to help alleviate fear and anxiety. Then as a nurse also, you are going to pay attention to all her grievances and try as much as possible to answer all her questions. And if anything, you need to refer those which you cannot answer to other members of the healthcare teams. Then the other intervention and rationale will be that you will acknowledge that it is normal for her to fear vision loss and respond promptly to her needs. Then you also need to explain to the patient the condition and the disease prognosis to simply allay anxieties. Then what will be your evaluation? Now, at the end of it all, you are going to observe that the patient will be able to rest and sleep within 24 hours. Other problem number 5 we discussed is self-care deficit. Now, the nursing diagnosis will be that self-care deficit related to visual impairment, which is evidenced by dirty around the bed and unkeptness around the patient. So what will be your goal? Your goal will be that the patient will be able to have appropriate self-care by achieving activities of daily living. What will be your interventions and some of the rationales? So here you need to assist the patient with activities of living. As well as you also need to let her participate in daily care where possible. Then here you are also going to say I will involve her relatives in care for her daily needs of living and explain the importance of every activity being done. Then your evaluation will be that the patient will be able to perform activities of daily living with minimal assistance. Okay, so this has been question C. Let's move to question D. On question D, here they are saying outline 5 complications and the following are the list of complications you can pick 5 from. So there is blindness, there is irreparable damage to the retina or retina detachment, there is also irreparable damage to the optic nerve, there is choroidal hemorrhage, there is ocular decompression retinopathy, there is also hemorrhagic choroidal detachment, there is also hypotony maculopathy, there is also malignant glaucoma, there is also vitreous hemorrhage as well as endophthalmitis. So these are the complications which you need to consider when answering glaucoma. So for now, this is where we end. This has been Mr. Dibo. If you haven't subscribed, subscribe for more YouTube videos and insights in general nursing. Thank you very much and stay blessed.